Hello, everyone. Welcome back to Mr. Daily English. I'm Emma.
And I'm Tim. Hey everyone, great to have you here today.
Today, we have a really important topic that many of you have asked us about. We're going to learn how to speak English at a doctor's office or hospital.
Yes, this is so practical because when you're not feeling well, the last thing you want is to struggle with English, right?
Exactly. And you know what? I remember when I first moved to an English-speaking country, going to the doctor was actually really scary for me.
Really? What happened?
Well, I had a terrible headache, and I didn't know how to explain my symptoms properly. I kept saying, my head is pain, instead of, I have a headache.
Oh no. But hey, we all make mistakes. That's how we learn.
Absolutely. So today, we're going to make sure you don't make those same mistakes. We'll practice everything from making an appointment to talking with the doctor and understanding prescriptions.
And we'll use real situations, just like you'd experience them. So grab a notebook if you want to take notes, and let's get started.
But before we begin, if you're new here, don't forget to hit that subscribe button and ring the notification bell so you never miss our lessons.
All right, let's dive in.
So, Tim, the first step when you need to see a doctor is usually making an appointment, right?
That's right. And this often happens over the phone, which can be extra challenging because you can't see the person's face or use hand gestures.
Good point. Let's go through a typical phone conversation. Tim, you can be the receptionist and I'll be the patient.
Sounds good. Ring ring. Good morning, City Medical Center. This is Tim speaking. How may I help you?
Hello, I'd like to make an appointment with Dr. Johnson, please.
Perfect. Now, notice Emma said, I'd like to make an appointment, not I want appointment or give me appointment.
Yes, I'd like to is polite and very natural. You can also say, I need to schedule an appointment, or can I book an appointment?
Great alternatives. Let me continue. Of course. May I have your name, please?
Yes, it's Emma Rodriguez.
Thank you, Miss Rodriguez. And what is the reason for your visit?
Now, this is an important question. They're asking why you need to see the doctor. You might say, I have a bad cough, or I've been having stomach pain, or I need a checkup.
Exactly. Let's hear your answer, Emma.
I've been having a persistent cough for about 2 weeks.
Notice she said persistent. That means it won't go away. It's a good medical word to know.
You could also say ongoing or continuous. These words show the problem keeps happening.
I see. How about next Tuesday at 10:30 a.m.? Would that work for you?
Actually, I work in the mornings. Do you have any afternoon appointments available?
Great. She politely asked for a different time. You can also say, would it be possible to get an afternoon slot? Or are there any evening appointments?
Let me check. Yes, I have 3 p.m. on Tuesday or 2:30 p.m. on Wednesday.
Wednesday at 2:30 works perfectly for me.
Wonderful. I have you scheduled for Wednesday, December 11th at 2:30 p.m. with Dr. Johnson. Please arrive 15 minutes early to fill out paperwork.
That's important. Arrive early means come before your appointment time, and fill out paperwork means complete forms with your information.
Great. Thank you so much.
You're welcome. We'll see you then. Have a good day.
And that's it, a complete appointment booking conversation.
Let's review some key phrases quickly. Repeat after us if you're practicing.
I'd like to make an appointment. Pause.
What is the reason for your visit? Pause.
Do you have any afternoon appointments available? Pause.
Please arrive 15 minutes early. Pause.
Perfect. Now you're ready to make an appointment by phone.
But what if you need to reschedule or cancel? Let's cover that quickly too.
Good idea. To reschedule, you can say, I need to reschedule my appointment, or is it possible to change my appointment time?
And to cancel, I need to cancel my appointment or I won't be able to make my appointment tomorrow.
Always try to give them at least 24 hours notice. That's polite and helps other patients get that time slot.
Exactly. Okay, are we ready for the next part?
Yes, let's talk about what happens when you arrive at the doctor's office.
So you've arrived at the doctor's office, you walk in, and there's a reception desk. What do you do?
First, you approach the receptionist and say hello. Let's practice this. Tim, you be the patient this time.
Okay. Hi, good afternoon.
Good afternoon. How can I help you today?
I have an appointment with Dr. Johnson at 2:30.
Perfect. Short and clear. You can also say, I'm here for my 2:30 appointment, or I have a 2:30 appointment with Dr. Johnson.
Great. May I see your ID and insurance card, please?
Okay, this is important. In many English-speaking countries, you need to show identification and proof of insurance.
Here you go.
Thank you. Since this is your first visit, could you please fill out these forms?
Ah, the forms. These usually ask for your medical history. Let's talk about what you'll see on these forms.
Right. You'll see questions like, do you have any allergies? That means, are you allergic to any medicines or foods?
You might see current medications. That's asking what medicines you take regularly.
Previous surgeries. Have you had any operations before?
Family medical history. What illnesses do your parents or siblings have?
These questions are important because they help the doctor understand your health better.
If you don't understand a word on the form, don't be shy. Ask the receptionist, "Excuse me, what does this word mean?" Or, "Could you explain this question?"
Absolutely. They're there to help you. After you finish the forms, you return them to the reception desk.
I've completed the forms.
Perfect. Please have a seat in the waiting room. The nurse will call you shortly.
Shortly means soon, usually within 10 to 15 minutes.
While you're waiting, you might hear them call your name. Tim Chen or Mr. Chen, we're ready for you.
When you hear your name, stand up and follow the nurse. You can say, "That's me," or just "Here."
Let's learn some key vocabulary you might see in a doctor's office. Tim, help me out.
Sure. Waiting room, where patients wait to be called. Pause.
Reception desk, where you check in. Pause.
Insurance, medical coverage that helps pay for doctor visits. Pause.
Medical history, information about your past health problems. Pause.
Allergies, things that make you sick or cause bad reactions. Pause.
Great. Now let's move to the examination room.
Okay, the nurse calls your name and takes you to an examination room. This is usually a small room with a bed or examination table.
The nurse will check your vital signs first. Vital signs are basic health measurements.
Let's role play this. Emma, you're the nurse.
Hi there. Come right in and have a seat on the exam table.
Thank you.
So what brings you in today?
This is another way of asking, "Why are you here?" You explain your problem. "I've had a cough for 2 weeks and it's not getting better."
I see. Are you experiencing any other symptoms? Fever, chest pain, difficulty breathing?
Notice she's asking about symptoms. These are signs of illness. Let's learn common symptoms.
Good idea. Fever, when your body temperature is higher than normal.
Cough, when you force air out of your lungs with a sudden sound.
Sore throat, pain in your throat.
Runny nose, when liquid comes from your nose.
Headache, pain in your head.
Stomachache or stomach pain, pain in your stomach area.
Nausea, feeling like you might vomit.
Dizzy or dizziness, feeling like the room is spinning.
These are super important words. Okay, back to our role play. Tim, answer my question.
No fever, but I do have some chest tightness, especially at night.
All right, let me check your vital signs. First, I'll take your blood pressure.
The nurse wraps a cuff around your arm and it gets tight for a moment. Just relax.
Your blood pressure is 120/80. That's good. Now let me check your temperature.
They might put a thermometer under your tongue or in your ear.
98.6 degrees Fahrenheit, normal, and your pulse is 72. Everything looks good there.
Pulse is your heartbeat. 60 to 100 beats per minute is normal.
Okay, the doctor will be with you in just a few minutes. Is there anything else you need while you wait?
No, I'm fine, thank you.
And then you wait for the doctor, usually just a few minutes.
Let's talk about how to describe pain because this is really important when talking to doctors.
Oh yes, there are different types of pain. Sharp pain, sudden and intense, like a knife.
Dull ache, constant but not very intense, like pressure.
Throbbing pain, pain that comes in waves, like your heartbeat.
Burning sensation. Feels like heat or fire.
You also need to describe where it hurts. You can say, in my chest, in my lower back, on the right side of my stomach.
And how long you've had the pain. For 3 days, since last Monday, on and off for a week.
On and off means it comes and goes, not continuous.
You might also need to describe how bad it is. On a scale of 1 to 10, how bad is your pain? The doctor might ask.
1 is very mild. 10 is the worst pain you can imagine. Be honest.
Right. Okay, now the doctor is coming. Let's see what happens.
Knock, knock. The doctor enters.
Hello, I'm Dr. Johnson. Nice to meet you.
Nice to meet you too, doctor.
The doctor would usually look at the nurse's notes first, then ask you to explain the problem again.
So, I understand you've been having a cough for about 2 weeks. Can you tell me more about it?
This is your chance to explain everything. Take your time and be detailed.
Well, it started about 2 weeks ago. At first, it was just occasional, but now I'm coughing a lot, especially at night. It's keeping me awake.
Good. She explained when it started, how it's changed, and how it affects her daily life.
Is it a dry cough, or are you coughing up phlegm?
Phlegm is the thick liquid that sometimes comes up when you cough. Some people say mucus, too.
A dry cough means no phlegm. A productive cough means you cough up phlegm.
It's mostly dry, but sometimes in the morning there's a little phlegm.
What color is the phlegm?
This might seem like a weird question, but color helps doctors diagnose. Clear or white is usually okay. Yellow or green might mean infection.
It's mostly clear, sometimes a little white.
Okay. Have you been around anyone who's sick, or have you traveled recently?
No, I haven't traveled, but my coworker had a cold last month.
I see. Let me examine you. Could you sit up straight and take a deep breath for me?
The doctor listens to your lungs with a stethoscope. That's the thing with 2 earpieces and a round metal part.
Breathe in deeply through your nose and out through your mouth. Good. Again, please.
Just follow the doctor's instructions. If you don't understand, ask, could you repeat that? Or what should I do?
Now I'm going to check your throat. Open wide and say ah. The doctor uses a wooden stick to look at your throat. It might feel uncomfortable, but it only lasts a few seconds.
All right, your throat is a bit red, but not too bad. Based on your symptoms, I think you have bronchitis.
Bronchitis is inflammation of the breathing tubes in your lungs. It's common after colds.
What's the treatment, doctor?
I'm going to prescribe you some medication. You'll take an antibiotic for 7 days twice daily, and I'll also give you cough syrup to help with the cough.
Prescribe means the doctor writes an order for medicine. Antibiotic is medicine that fights bacterial infections.
This is a good time to ask questions. Don't be shy. The doctor wants you to understand.
Let me show you some good questions to ask. How long until I feel better?
You should start feeling better in about 3 to 5 days, but finish all the antibiotics even if you feel better.
That's important. Always finish antibiotics as prescribed.
Are there any side effects I should know about?
Side effects are unwanted effects from medicine, like stomach upset or drowsiness.
The antibiotic might cause some stomach upset. Take it with food. The cough syrup might make you drowsy, so don't drive after taking it.
Drowsy means sleepy. Great question. What else?
Is there anything I should avoid while taking this medication?
Yes, avoid alcohol while on antibiotics, and drink plenty of fluids, water, tea, soup.
Should I come back for a follow-up?
A follow-up is another appointment to check your progress.
Yes, if you're not better in a week or if your symptoms get worse, call us immediately. Otherwise, you should be fine.
What if I have chest pain or trouble breathing?
Excellent question. Always ask about warning signs.
If you develop chest pain, high fever over 102 degrees, or difficulty breathing, go to the emergency room right away. Those could be signs of something more serious.
Thank you, doctor. I really appreciate your help.
You're welcome. Take care and feel better soon.
Perfect. Now let's review some important phrases for talking with doctors. Ready?
I've been having symptom for time period.
The pain is located in my body part.
What's the treatment?
Are there any side effects?
How long until I feel better?
Should I come back for a follow-up?
Great! Now what happens next? You need to get your prescription.
After leaving the doctor's office, you go to the pharmacy to get your medicine.
In American English, we usually say pharmacy. In British English, people often say chemist.
Right. Let's practice what happens there. Tim, you be the pharmacist.
Good afternoon. How can I help you?
Hi, I need to fill this prescription, please. Hands over paper.
Fill a prescription means to get the medicine the doctor ordered. You can also say pick up a prescription if you're collecting medicine you ordered earlier.
Certainly. Let me check our system. This will take about 15 minutes. Is that okay?
Yes, that's fine. I'll wait.
Sometimes they take longer, maybe 30 minutes to an hour. You can leave and come back or wait in the store.
If you're in a hurry, you can ask, how long will it take? Or, can I come back later to pick it up?
After waiting, Mr. Chen, your prescription is ready.
Great, thank you.
I have your antibiotic and cough syrup here. Let me go over the instructions with you.
This is really important. Listen carefully to how to take your medicine.
For the antibiotic, take 1 tablet twice daily with food. That means 1 in the morning with breakfast and 1 in the evening with dinner.
If you don't understand, ask, could you explain that again? Or what does twice daily mean?
Continue taking it for 7 days until all tablets are gone, even if you feel better. Don't skip doses.
A dose is 1 amount of medicine. Skip means to miss or not take.
For the cough syrup, take 2 teaspoons every 4 to 6 hours as needed. Don't take more than 6 doses in 24 hours.
As needed means only when you need it, not on a regular schedule.
Don't drive or operate machinery after taking the cough syrup because it may cause drowsiness. Do you have any questions?
Yes, can I take these 2 medicines together?
Good question. Yes, they're safe to take together. Just take the antibiotic with food, and you can take the cough syrup whenever you need it.
What if I forget a dose of the antibiotic?
If you miss a dose, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one. Don't take a double dose.
Okay, got it. How should I store these?
Another great question. Storage is important.
Keep both medications at room temperature, away from heat and moisture. Don't store them in the bathroom. Keep them out of reach of children.
Thank you so much for explaining everything.
You're welcome. Your total is $45 today.
And you pay for your medicine. Insurance might cover some of the cost.
Let's review important pharmacy vocabulary. Prescription, doctor's order for medicine.
Tablet or pill, solid medicine you swallow.
Capsule, medicine in a gelatin shell.
Liquid or syrup, medicine in liquid form.
Dosage, how much medicine to take.
Side effects, unwanted effects from medicine.
Expiration date, the date after which medicine shouldn't be used.
Perfect. Now you know how to handle the pharmacy.
Now, let's talk about emergencies. Sometimes you can't wait for an appointment. You need immediate help.
Right. If you have a true emergency, you call emergency services or go to the emergency room.
In the United States and Canada, you call 911. In the UK, it's 999. In Australia, it's 000. Know your local emergency number.
What's considered an emergency? Let's list them. Severe chest pain, difficulty breathing, severe bleeding, broken bones, loss of consciousness.
Also, severe allergic reactions, poisoning, severe burns, or symptoms of a heart attack or stroke.
If you call emergency services, stay calm and speak clearly. Let's practice.
911, what's your emergency?
My husband is having severe chest pain and trouble breathing.
Okay, stay calm. What's your location?
We're at 123 Oak Street, apartment 4B.
Is he conscious? Is he breathing?
Conscious means awake and aware. Yes, he's conscious and breathing, but he says the pain is very bad.
Okay, an ambulance is on the way. Keep him calm and comfortable. Don't give him anything to eat or drink.
Notice the dispatcher gives clear instructions. Follow them carefully.
If you go to the emergency room yourself, when you arrive, tell them, "This is an emergency," or "I need immediate help."
Explain briefly, "I'm having severe chest pain," or "I've been in a car accident."
They'll assess how urgent your situation is. This is called triage.
The most serious cases are seen first.
You might have to wait if your problem isn't life-threatening, but don't leave. Get checked out.
Important vocabulary for emergencies: ambulance, emergency vehicle.
Emergency room, or ER, hospital department for emergencies.
Paramedic, person trained to give emergency medical care.
Life-threatening, dangerous enough to cause death.
Remember, if you're not sure if it's an emergency, it's better to be safe and get checked out.
Okay, Tim, let's talk about common mistakes people make when speaking English at the doctor's office.
Great idea. Number 1, saying I am pain instead of I have pain or I'm in pain.
Right. In English, we have symptoms. I have a headache. I have a fever. I have nausea.
Mistake number 2, using the wrong preposition. People say pain for my head, but it should be pain in my head or my head hurts.
Actually, both are correct. You can say, I have pain in my head, or my head hurts.
Oh, you're right. Okay, mistake number 3, being too vague. Saying just, I feel bad, doesn't help the doctor.
Exactly. Be specific. Say, I have a sharp pain in my lower back, or I've been vomiting for 2 days.
Mistake number 4, not asking questions when you don't understand. If the doctor uses a word you don't know, ask.
Yes. Say, could you explain what that means? Or, I don't understand that word.
Mistake number 5, not bringing important information. Always bring your ID, insurance card, list of current medications, and list of allergies.
Good point. Write these down before you go to the doctor.
Here are some helpful tips. Tip 1, practice describing your symptoms before you go. Look up medical words if you need to.
Tip 2, bring someone with you if you're very nervous about speaking English. They can help translate if needed.
Tip 3, don't be embarrassed. Doctors have seen and heard everything. Be honest about your symptoms.
Tip 4, take notes during your appointment. Write down the diagnosis, treatment plan, and follow-up instructions.
Tip 5, if you don't understand something, ask them to write it down for you.
Okay, Tim, let's talk about common mistakes people make when speaking English at the doctor's office.
Great idea. Number 1, saying I am pain instead of I have pain or I'm in pain.
Right. In English, we have symptoms. I have a headache. I have a fever. I have nausea.
Mistake number 2, using the wrong preposition. People say pain for my head, but it should be pain in my head or my head hurts.
Actually, both are correct. You can say, I have pain in my head, or my head hurts.
Oh, you're right. Okay, mistake number 3, being too vague. Saying just, I feel bad, doesn't help the doctor.
Exactly. Be specific. Say, I have a sharp pain in my lower back, or I've been vomiting for 2 days.
Mistake number 4, not asking questions when you don't understand. If the doctor uses a word you don't know, ask.
Yes. Say, could you explain what that means? Or, I don't understand that word.
Mistake number 5, not bringing important information. Always bring your ID, insurance card, list of current medications, and list of allergies.
Good point. Write these down before you go to the doctor.
Here are some helpful tips. Tip 1, practice describing your symptoms before you go. Look up medical words if you need to.
Tip 2, bring someone with you if you're very nervous about speaking English. They can help translate if needed.
Tip 3, don't be embarrassed. Doctors have seen and heard everything. Be honest about your symptoms.
Tip 4, take notes during your appointment. Write down the diagnosis, treatment plan, and follow-up instructions.
Tip 5, if you don't understand something, ask them to write it down for you.
These tips will make your doctor visits much easier.
Wow, we've covered so much today. Let's do a quick recap of everything we learned.
We started with making an appointment on the phone. Remember, I'd like to make an appointment.
Then, checking in at the reception desk, I have an appointment at 2:30.
The nurse takes your vital signs and asks about symptoms. I've been having a cough for 2 weeks.
The doctor examines you and prescribes treatment. What's the treatment? Are there any side effects?
At the pharmacy, you get your medicine. I need to fill this prescription.
And in emergencies, stay calm and speak clearly. This is an emergency. I need immediate help.
Remember, the most important thing is to be clear and specific about your symptoms.
Don't be afraid to ask questions. Doctors and nurses want to help you understand.
Now, let's do a quick practice exercise. Imagine you have a bad stomach ache. What would you say to the doctor?
Think about it. You could say, I've been having severe stomach pain since yesterday, or my stomach hurts really badly and I've been vomiting.
Perfect. Now you try with different symptoms. Practice at home.
All right, everyone. That's it for today's lesson on speaking English at the doctor's office.
We hope this helps you feel more confident when you need medical care in English.
Remember, your health is the most important thing. Don't let fear of speaking English stop you from seeing a doctor.
Practice these phrases, write them down, and you'll be ready when you need them.
And hey, if you found this lesson helpful, please give us a thumbs up. It really helps us know what content you enjoy.
Don't forget to subscribe to Mr. Daily English if you haven't already. Hit that notification bell so you never miss our lessons.
We post new videos every day to help you improve your English in real-life situations.
Leave us a comment below. Tell us, what other situations would you like us to cover? The airport? The bank? Job interviews?
We read all your comments and we make videos based on your requests.
Also, share this video with your friends who are learning English. Let's help each other improve.
Thank you so much for watching today. Take care of your health and keep practicing your English.
See you in the next lesson.
Bye, everyone.